A very common question is, what is the difference between an Erchonia Class 2 laser versus a Class 3 or Class 4 lasers that you're probably extremely familiar with in the veterinary market? The Erchonia laser is going to be using a true visible light laser. So we are on the visible light wavelength, which is way smaller or lower on the wavelength spectrum. So in a Class 3, Class 4 laser, they're always going to be using over a 750 nanometer wavelength, which is going to be either near infrared or even infrared. So the higher the wavelengths go, the more heat inducing they get. They also have a lower energy. So when we're talking about the classifications, truthfully, it just comes down to the dangers that are determined based off of the FDA for the classifications of use. So a Class 2 laser is considered a non-significant risk. And what that means is that you do not have to wear goggles. You do not have to worry about burning the patient. You can treat from a distance so that you can actually treat a larger surface area with our line-generated beams. You do not have to worry about overstimulating or causing any damages to the body. Class 3 and Class 4, the higher the classification goes, the more dangers are associated with the laser. So it's truthfully just a classification. And then Erchonia laser is extremely different because of the fact that we use a photochemical effect. So in the visible light spectrum, we are not going to have any thermal application. There's no heat ever with that, but it's very high energy. So Erchonia lasers have a photochemical systemic effect versus a topical thermal effect that you would get with a Class 3, Class 4 laser. So a lot of questions come into play about the depth of penetration and how the lasers will affect different types of tissues with that. The depth of penetration when it comes to heating tissues with a Class 3 or Class 4 laser is very important because we would like to get to those specific types of tissues with a topical heating effect. With our lasers, we're having more of a drug-like effect in the body. So we are actually working through energy absorption and communication throughout the body. And Erchonia has studied the mitochondria so specifically that we are looking at every single complex on the electron transport chain and where these specific wavelengths are the peak absorption, which is where we came with the 405 nanometers violet light and then the 635 red. So these have extremely high energy, no heat, but you do not have any adverse effects with that. So we are going to actually have the most researched laser in the market. We have over 22 FDA clearances in the human market. Everything we do is through double-blind, placebo-controlled, multi-site, and randomized clinical trials. And so we have the most proven, effective, and researched laser in the market, not to mention the most energetic. So when we're actually looking to accomplish a systemic change using a photochemical or changing that photobiology in the body, we're able to have a drug-like effect where you could take like an NSAID for pain relief, you take it orally, and it affects the different areas of pain in your body. Lasers do that through the exact same receptors, but we're actually using it in a systemic effect without those side effects that you would get from those particular drugs in the market. So that's just a little synopsis of what the difference is between the Erchonia Class 2 versus a Class 3, Class 4. If you have any additional questions, again, my name is Malia Ellis, and I am here to help you with any of your questions about our lasers.